not many people actually know that speech and language therapists work on the front line, especially with COVID patients. So I'm wondering whether you can share with us a bit more about what's the role of the speech and language therapist working with COVID patients.
Sure. So here in the acute hospital, our main focus on COVID patients will definitely be their ability to swallow safely. These patients may develop swallowing difficulties due to the prolonged presence of a breathing tube during their ICU stay, or sometimes they might have some medical conditions that could also cause some difficulty swallowing. So what the SLT does here is to assess the safety of their swallowing. We want to ensure that these patients are able to eat and drink safely without food or drinks entering their airway when they swallow. So this could further compromise their respiratory status. So I would say that would be the main aim of our intervention with COVID-19 patients.
Okay, so it mustn't be very easy for patients during their stay. How do you think speech language therapists like yourself on the front line can make a difference to them during their time at the hospital?
I think most importantly is I told myself to be myself, making small talk, just adjusting what's at present at bedside, make sure that they're comfortable after the session, asking them if they need a blanket or an extra pillow. I think that's important because a lot of the times what they lack probably in the wards is a bit of interaction. And I think as different healthcare professionals go in, the interaction with them would probably make a lot of difference.
Yeah, and some people say, Dawn, aren't you scared, working in such positions? How do you keep yourself safe?
I think most importantly is we do have to be very, very aware of our hand hygiene, of our PPE donning and doffing sequence. Over here, we have a buddy system. So someone else, like maybe a nurse, could just quickly do a quick check on you to make sure that you've got everything in place before you enter the rooms. And I guess the other tip for myself is to make sure that I've got everything with me so that there is less need for me to go in and come out again.
Right, okay. Now you are also an associate faculty with the SLT program at the university at SIT. What do you think about how we teach our students currently to make sure that they are ready to enter the workforce?
Sure. Not to be biased, I'm sure this happens for all the courses out there, but I also just wanted to say that a lot of thought had gone into the creation of this course, and really the commitment and the heart that the main faculty has put into this is just amazing. I think this course brings together very various modes and models of teaching. We've got the lectures, we've got the practical classes, we've got the group work and clinical placements, and all these just provided plenty of opportunities for a student to learn and to put what they learn into practice. We've got very authentic learning experiences. I think it's a great and safe environment to practice in-house before using these skills in a more clinical setting. And I think these various placement opportunities that have been sought for the students will provide them with the first-hand experience that they need, and to experience what the job is like, and to get the feedback for continued improvement in their own clinical learning journey.